All right, the latest news break coming in, and this is important, so do listen in carefully. Now, the Health Ministry has included the sudden loss of smell and taste as symptoms of coronavirus. In the new clinical guidelines that have been issued, a loss of smell or a loss of taste preceding the onset of respiratory symptoms has also been reported as clinical guidelines. Validate India Today's news break. Now, more coming in on this is that azithromycin has been removed as a combination with HCQ for treatment of mild to moderate cases of coronavirus. All right, that's the latest that we are getting in. New symptoms have been added for coronavirus. The Health Ministry has just added the symptom of a sudden loss of taste or a sudden loss of smell and has attributed to it as a possible coronavirus symptom which precedes respiratory disorder. Moreover, the Health Minister guidelines have validated India Today's news break with azithromycin now will not be a part of the combination of drugs to be used for COVID-19 positive patients with HCQ. Connecting to my colleague Milan Sharma, who's been tracking the developments very closely with the Health Ministry. Milan, would you get us up to speed? So a sudden loss of smell and taste, new symptoms added to the coronavirus symptom list. What more can you add to it?
Yes, Preeti. In fact, you and I and everybody knows that initially the symptoms of coronavirus were being taken for what was being shown in the patient. So it used to be a runny nose or a headache or fever with cough. But now the new clinical guidelines of the Health Ministry have added loss of smell, which is known as anosmia, or loss of taste, which is ageusia. And these are preceding the onset of respiratory symptoms as what is being reported in the new clinical guidelines. And this is something new that has been added because along with this, the ministry also says that diarrhea is also being reported as an atypical symptom of coronavirus having been studied in patients. So this they have found out after studying at least 15,000 such patients. And let me quickly tell you that their data shows only 3% actually report a runny nose, 7% report weakness, 8% report breathlessness, 10% report sore throat, and 21% report cough, while 27% report fever. But quite surprisingly, 24% of this data shows that these are symptoms that are unreported. It's put in the others category. So this is the new category this is being created. Loss of taste and loss of sensation of smell is now being added to the symptoms of coronavirus in India.
Moreover, Milan, now that cocktail of drugs which was being given with azithromycin along with HCQ to coronavirus positive cases, it seems now azithromycin has been removed from that.
Yes, Preeti. In fact, azithromycin, experts feel, does not really clinically help treat coronavirus as much. This is the expert opinion. A top ICMR official India Today spoke to has confirmed that studies show with a combination of HCQ when it was given earlier to mild and moderate cases only. The new clinical guidelines also don't have this combination of HCQ with azithromycin for severe cases. Remdesivir is being looked at to be given and administered to severe cases. And the ministry feels, with a lot of experts and doctors who feel that HCQ will definitely be continued to be given to the patient for mild and moderate cases, but azithromycin at this point of time is not required. So they have removed it in the list of medical and clinical treatment that is being given to COVID patients.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.